I got vaxxed, and I encourage you to get vaccinated.
Take the vaccine, take the vaccine, need it.
I think this is definitely the way so we can make it, so things can go back to normal.
I feel that getting vaccinated is something that's necessary for us to go back to normal like how things were before, and I'm excited to be like one of the first people to get a new vaccine.
I'm a little nervous, but kind of excited at the same time.
I'm going to take my Covid-19 vaccine.
How do you feel about that?
I'm a little nervous, but I'm excited because I don't like injection.
I don't want to get COVID, so I'm really happy to take the vaccine. And I want everybody else to take the vaccine because it's very important. Get vaccinated.
Good afternoon, ladies and gentlemen, to the listening and viewing public here and abroad. And thank you once again for joining us for this COVID-19 update. We have the distinct pleasure of having with us the National Epidemiologist, Dr. Shaluddin Ahmed, and the Assistant Commissioner of Police, Mr. Davidson Valerie. We'll welcome first Dr. Ahmed.
Thank you, Ms. Harry. First, I recognize presence of our Deputy Police Chief, Mr. Valerie. Good evening to everyone, home and abroad. COVID-19 status update. As at November 1st, 2021, total number of new cases 80, 74 antigen positive cases, and one little correction on the media is that 6 PCR positive cases as opposed to 8 PCR positive cases. Our total active cases 349. Total recovered cases so far 4,537. Total COVID associated deaths 32. Vaccine coverage as of November 1st, 2021, 52.7% of the target population took at least one dose of vaccine, and 47.8% of the target population are now fully vaccinated. With respect to COVID-19 cases, of daily trend of COVID-19 cases from July 28 to November 1st, 2021, our number of cases are going down. In the past week, we had on average 35 cases as opposed to 44 cases previous week. In terms of demographic of those new cases that we have, that include mostly in the age group of 18 years and 65 years age group, most of them, and male to female ratio almost 1 to 1. We do have cases from under 12 years age group, some 12 to 17 years, and very minimum about 4 cases over 65 years age group. In terms of their clinical presentation, with respect to their severity, 71% are mild, their presentation. and 29% moderate. And there had not been any case of severe on November 1st, 2021. In terms of active cases, that is as of October 29, we number of cases that were admitted in our COVID care complex. The proportion of male to female is 44% to 44% female to 56% male. And in terms of active cases by their age group, most of them are between the 18 years and 59 years age group. Then we had under 18 years age group, and then 60 and over. In terms of their clinical presentation, proportion of those of active cases by severity, 78% are mild, those who did not have or very mild symptoms. 16% had moderate symptom, and 6% were severe. In terms of positivity rate, that's important that we have to make a note that the positivity rate remain between 6 and 7. As of last week, we had positivity rate in 7%, that is. That means every 100 were tested, of them 7 were positive of COVID case. COVID-associated death, total number of deaths as of November 1, 2021, we had a total of 32 cases, 14 males and 18 females. Age range 40 years to 107 years. The median age 80 years. The comorbid conditions, most or 97% had underlying medical conditions. Their vaccination status, 29 out of 32, 90% were unvaccinated. Okay, I put this slide there in terms of comparison with respect to vaccination in the OECS and Barbados. As you can see, we are not doing that bad in terms of Dominica. This is as of October 30th, 2021. These percentage actually out of total population and based on our world in data. So we are in between, we are above the St. Lucia, St. Vincent and Grenadines and Grenada. On the other hand, we have much more work to be done with respect to reaching to the herd immunity or increasing the percentage of vaccination in Dominica. As you can see, Antigua is about 57% of their population now, Barbados 52, and St. Kitts and Nevis 49, ahead of Dominica at this time. I spoke about long haul COVID last presentation. I wanted to show you many more images of the long-term complication of COVID-19. Today this is about lung, how the healthy lung looks like in CT scan as opposed to a lung looks like with COVID-19. On the right hand side of the screen you can see there's a COVID-19 infected lung, and you can see ground glass appearance, and over a period of time this will turn into scar tissue, and the lung of that side, mostly over 60% of the lung field are compromised actually with COVID-19 and reducing the lung function or lung capacity. With respect to new research on this long haul COVID, this recovery from this lung injury takes more than 3 months, over 3 months, it's not quick. It takes long to recover from this COVID-19. With this in mind, I want to remind the general public is this: continue to wear face mask, avoid social gatherings, keep 6 feet distance anyone other than household members, and wash or sanitize frequently. Thank you again for your attention. Happy Independence Day.
Thank you so much, Dr. Ahmed. And very quickly, another look at the numbers. 18 new cases as of November 1st, 349 active cases here in Dominica. And unfortunately, we have to report 32 deaths associated with COVID-19. Also with us this afternoon is the Assistant Commissioner of Police, Mr. Davidson Valerie.
Dr. Shaladin Amid, National Epidemiologist. Ms. Shina Harry, Communication Specialist in the Ministry of Health, Wellness and New Health Investment. Members of the media, members of the listening and viewing public, good afternoon. As Dominica continues to grapple with the onslaught of COVID-19, the Commonwealth of Dominica Police Force wishes to encourage everyone to please conform to the legislations in place to prevent the further spread of COVID-19 in Dominica. We can only blame ourselves for the ordeal which now confronts us as we mourn the pains of losing our loved ones ever so often. The police force, however, remains resolute in its combined efforts with the Ministry of Health in striving to prevent the further spread of COVID-19 in Dominica. We have maintained our border patrols on land and on sea. While there has been much success with the interceptions of illegal migration, the challenge persists. We are therefore calling on those who continue to engage in the criminal practice of illegal entry and exit from Dominica to desist from these activities. The police force has always been persistent with mobile and foot patrols in the city and at various communities around Dominica. An amendment to the Environmental Health Services SRO 26 of 2021 by SRO 43 of 2021 was published on the 28th of October 2021. The law stipulates that a person shall not host or attend a private party, which includes any person from outside the immediate household of the house occupant. A person shall not host or attend a recreational or competitive sporting event. A person shall not host or attend a wedding which hosts more than 100 persons, including the bride, bridegroom, official witnesses, and the marriage officer. A person shall not host or attend any social event. A person shall not host or attend a funeral with more than 100 persons, including members of the immediate family, and at least one officiant and essential mortuary staff. In an effort to prevent the spread of COVID-19, a person shall not host a gathering of more than 50 persons unless the person has the written permission of the Chief of Police. A person at a gathering shall maintain a physical distance of at least 6 feet from another person and shall adhere to the mandatory mask requirement. All bars shall be open for the purchase and pickup only, and there shall be no music played at the bar, no congregating at any of the bars, there shall be no consumption of alcohol on any of the premises. I will say that again. A person at a gathering shall maintain a physical distance of at least 6 feet from another person and shall adhere to the mandatory mask requirements. All bars shall be open for purchase and pickup only, and there shall be no music played at any bar, no congregating on the premises of any bar, no consumption of alcohol on the premise of any bar. All nightclubs shall remain closed. All religious places of instruction or worship may be open to allow no more than 100 persons to attend a service, a wedding, or funeral. All religious places of instruction or worship shall ensure that persons maintain physical distancing of no less than 6 feet in and outside the religious places of instruction or worship. The Environmental Health Department shall determine and certify the number of persons that may be permitted at any one time in each religious place of instruction and worship. Any religious place of instruction or worship who contravenes this regulation commits an offense. We are therefore asking everyone to be guided accordingly and obey the regulations. Last weekend, we witnessed the abhorrent behavior of many people who crowded the streets of Roseau in what appeared to be a festive moment. We were also informed that there was music being played at some bars. Many persons were seen not wearing masks in contravention of the regulation. These behaviors in this time of COVID are unlawful, and we want to warn against such activities. Last weekend, police officers in Roseau preferred 26 charges against persons for various offenses under the COVID-19 regulations, including failing to wear a mask in a public place and playing music at a bar. As we approach the 2 independent days of holidays, please be reminded that everyone must obey the laws in respect of COVID-19 regulations. There must be no clustering or any gathering of more than 100 people in any location. There must be no music played at any bar, no congregating or consumption of alcohol at any bar. Again, all nightclubs must remain closed. Finally, persons accessing the beaches and rivers must conform to the regulations. No more than 100 persons will be permitted to access the beach or the river at any time. Let us all be responsible in the way we conduct ourselves in order to prevent the further spread of COVID-19 and to return to a state of normalcy. I thank you.
Our thanks to the Assistant Commissioner of Police, Mr. Davidson Valerie, and of course to the entire Commonwealth of Dominica Police Force for your continued enforcement of these laws and these protocols. Ladies and gentlemen, I'd like to remind us, though, that we each have an individual responsibility to adhere to these laws and protocols. Although this is a time for celebration, it is not a time for complacency. As we look forward to celebrating the 43rd anniversary of our independence, we find ourselves navigating uncharted territory and also exploring innovative ways to commemorate this occasion. However, we remain thankful to live in a country where many can only dream of visiting. So it's our patriotic duty to protect ourselves and those we care about. And the only way to do that is to continue to adhere to the health and safety protocols and, of course, to get vaccinated. We thank you for your kind attention this afternoon, and we wish each and every one of you a happy 43rd independence. Good day.
Hi everyone, I'm Nadia Carol Peanut, Head of the Adult Education Division.
Hi, my name is Miss Raj. I'm the Minister Secretary for Ministry of Governance.
Hi, I'm Consuelo Warrington, Administrative Assistant at the Establishment Personnel and Training Department.
Hi, I'm Shamil Thomas from the Ministry of Governance.
Hi, I'm Bruna John Baptiste, Senior Clerk, Establishment Personnel and Training Department.
Hi, I'm Emmeline Augustine, Establishment. Just wanted to know that
I got vaccinated.
I got vaxxed.
I got vaccinated. I got vaccinated.
I got vaccinated.
I got vaxxed.
And I encourage you to get vaccinated.
Take the vaccine. Take the vaccine. Need it.
I think this is definitely the way so we can make it, so things can go back to normal, you know?
I feel that getting vaccinated is something that's necessary for us to go back to normal like how things were before, and I'm excited to be like one of the first people to get a new vaccine.
I'm a little nervous.
Kind of excited at the same time.
I'm here to take my Covid-19 vaccine.
How do you feel about that?
I'm a little nervous, but I'm excited because I know I can catch it.
I don't want to get COVID, so I'm very happy to take the vaccine. And I want everybody else to take the vaccine because it's very important.